CBS 46 News presents Public Affairs on Peach.
Good morning and welcome to Public Affairs on Peach. I'm Karen Greer. This morning, we're going to talk about lung cancer. The Centers for Disease Control and Prevention says among new cancer cases, it ranks third behind female breast and prostate cancer for men. There are the numbers on the screen right there for you. But when it comes to cancer deaths per 100,000 people, the CDC says it's the deadliest, ahead of female breast and prostate cancer. In fact, the number of lung cancer deaths doubles female breast cancer deaths. Well, we are going to talk about that for the next half hour, from its diagnosis to treatment to myths. And we begin the discussion with Dr. Rabi Bakara from the Cancer Treatment Centers of America in Atlanta. Thank you so much for being here with us.
Thank you so much for having me.
A subject that a lot of us don't like to talk about, and especially when it comes to lung cancer, folks think they know everything there is to know about it. Like they believe you get it because you were a smoker. That's a myth.
Well, not completely a myth.
Okay.
You do get it because nicotine does definitely predispose you of developing lung cancer. And we've been learning, and we have learned that actually many individuals who develop lung cancer do not have had to smoke. So you can develop lung cancer even if you're not a smoker.
Wow. And quite a few people actually you found have developed it that have never smoked a day in their life.
That's unfortunately correct.
Wow. Now, quite a few people vape now. That's a big thing, especially the young kids, and many of them are getting sick from it. How much do you know about the damage it causes to lungs?
Vaping is still a nicotine substance. It definitely has less products than the cigarettes has. But it's still addictive, which is very important. Many individuals start vaping and eventually go to cigarettes. So it can be actually a path to cigarettes, and hence it's also dangerous. And because it's nicotine, it does predispose you to lung cancer. Not only that, but also head and neck cancer, throat cancer, tongue cancer, as well as esophageal cancer.
And we talk about when you're vaping, you think it's not as much, but I still see the plumes of smoke. So could you still perhaps get it from being next to someone who's vaping?
This is called secondhand smoking, and there's also third-hand smoking. Secondhand smoking does predispose you to develop lung cancer. It is not, though, as much studied, and it's not as much documented by numbers, because you cannot tell how much secondhand smoke you were exposed to as compared to how much you smoked as pack year smoking. So we don't have numbers on that, but the short answer is that yes, it does.
And what about another thing? When we were researching this, we saw radon gas is a big factor. What is that gas and how is it affecting people?
So radon gas is actually present in the ground, and people usually get exposed to it because actually it comes from the ground into their homes, their plumbing, and the different areas have different amount of radon gas. Some actually areas where you have to build, you have to check how much radon you have there. And if you have above a certain limit, which is parts per million, then you may not be able to build your house. Not all the homes are checked for radon.
Wow.
It's not mandated. And individuals check that on their own. It does predispose to lung cancer. The data behind radon gas is not as strong as it is behind nicotine, just because not many studies have been done on that. Can
somebody go to a store, buy a radon gas detector?
You can go to a store and buy a radon gas detector.
And check your limits.
Yes.
And now let's talk about symptoms that may persuade someone to go and be checked. What are the things that they should look out for?
See, this is the sad part about lung cancer. And this is why lung cancer, as you said, is the number one cancer killer among men and women. And the reason why is because the majority of the cases are diagnosed late. So why are they diagnosed late? Because there are no specific signs and symptoms for lung cancer. It's very non-specific. Some individuals just have cough. Of course, if somebody spits blood, this is very alarming, and you definitely have to go and check yourself. Some people develop blood clots, which can be from so many reasons. Part of it is actually if they have malignancy or cancer, it's predisposed them to develop blood clots. Some people just feel short of breath, but there are so many things that cause shortness of breath, whether they are lung-related or heart-related or blood vessels related. So there are no specific signs and symptoms. That said, if definitely you're coughing up blood, if you're losing weight, I'm sure it developed blood clots, your doctor is going to look for that. If you feel tightness in your chest, then you definitely have to think about it and bring it up to your physicians. And it's basically up to him or her to go down that pathway.
All right, so many more questions. Doctor, thank you so much for joining us. We want to outline some of the causes of cancer, and we're going to talk about how to treat it as well. No one unique treatment option to Atlanta. So we're going to discuss all of that and introduce you to some folks who know about it firsthand. Public Affairs on Peach will be right back.